Assalamu alaikum. I welcome all the students to my channel ITEL Pharma. So today I am going to demonstrate a topic related to general pharmacology. So what is general pharmacology? It is related to general study related to drugs. So today I will be demonstrating about drug excretion. So yes. Bismillahirrahmanirrahim. What is drug excretion? The removal of drugs from the body is called drug excretion. Drugs are eliminated in saliva, bile, or through lungs. Means the gaseous form, the inhalers particularly, are removed through the exhalation process of breathing. However, the kidneys are the primary sites for drug excretion. Each kidney is composed of approximately 1 million nephrons. Usually the metabolized or conjugated version of the original drug reaches the nephron and is then filtered at the glomerulus. Following filtration, the compound traverses the proximal convoluted tubule, loop of Henle, and distal convoluted tubule before reaching the collecting ducts. If a compound not absorbed while moving through the nephron, it will ultimately leave the body in the urine. Biotransformation is called metabolism, which plays a main role in creating a polar water-soluble metabolite and that is able to reach the kidneys and then excreted through urine. So this topic basically tells us about how drugs get removed from the body. So simply you have to memorize that if you take any sublingual form of drug, so it will get eliminated through the saliva. Some drugs get eliminated through the bile and some get eliminated through the lungs through exhalation process. Especially the inhalation form of drugs may get eliminated through exhalation process, like the nasal sprays and the antiasthmatics sprays, etc. However, the main organ of excretion are the kidneys. So the basic anatomical structure, it is composed of nephron. The structure and functional unit of kidney is nephron. So each kidney is composed of 1 million nephrons. So then they are talking about the metabolism process, that the drugs first get metabolized, they converted into inactive form or the waste, and then these waste get converted into conjugated version, and then the conjugated version may reach to the nephron, that is the kidneys, and then first they get filtered through the glomerulus, then after glomerulus they will move towards the proximal convoluted tubule, then loop of Henle, then distal convoluted, then collecting ducts, and finally the ureter, and after the ureter they will move towards the urinary bladder and get excreted in the urine. Now we will move towards our next phases of drug excretion. What are the different phases involved in the process of drug excretion? So basically three types of phases are involved. Number one is glomerular filtration, because the anatomical structure of the nephron first composed of the glomerulus, so that is why we here will study the stepwise processes. So first, glomerular filtration take place. Lipid solubility and pH do not influence the passage of drugs into the glomerular filtrate. However, changing the pH and glomerular filtrate rate and plasma binding may affect this process. So they are talking about that how and which drugs get eliminated through glomerular filtration process. So they are talking that if a drug is lipid soluble in nature, and if Its pH do not cause any effect while passing towards the glomerular filtrate. Uh, but if we change the pH of the glomerular filtrate and the plasma binding of the drug may take place, then the glomerular filtration may be slow or may be faster. By changing the pH of the glomerular filtrate and the binding process may change the glomerular filtration process. Although the lipid solubility and the drug pH may not cause any uh, influence on the glomerular filtration process. Next is proximal tubular secretion. Drugs that are not transferred into the glomerular filtrate enter into the proximal tubules from the efferent arteriole into the proximal tubule. So the second process tells us that if the drug fails to pass through the glomerulus, then it will then enter from the efferent arteriole into the proximal convoluted tubule and then will get eliminated in the urine. The third step is the distal tubular reabsorption. Sometimes the uncharged drug may diffuse back from the lumen of the kidney into the systemic blood circulation. So here the reabsorption of drug back into the blood may take place. Now moving towards the diagrammatic representation, it will tell us and demonstrate the students about the basic concept that how these phases may occur. Bismillahirrahmanirrahim. First, we will understand the anatomical structure of nephron. So basically, the nephron is composed of first part, which is the glomerulus. So we all know that the glomerulus is a cluster of tiny blood capillaries. So then after this glomerulus there is cup shaped structure which is called Bowman's capsule. Then after Bowman's capsule there is first tubular part and it is in coiled form, so we called it proximal convoluted tubule. After the proximal convoluted tubule, a U-shaped tubular structure can be seen. This is called a loop of Henle. You can see it is U-shape. After the loop of Henle, as it is labeled here, there is again coiling of the tubule at the ending portion. So as this portion is far away from the glomerulus, so we called it as distal convoluted tubule. Convoluted means in coiled form. Then the collecting tubules may form, and then the ureters, and then the urinary bladder, and then the urine excretion may take place. So we have here two types of arterioles which can be seen in the diagram. Afferent A, it starts from A, letter A. So it means when an arteriole is entering into the glomerulus, we called it as afferent arteriole, and when the arteriole is getting its exit from the glomerulus, we called it as efferent arteriole. So basically, normally a drug may pass from the glomerulus. It acts as a filter and uh, gets filtration of the drug, and the waste product may pass out from the glomerulus into this proximal convoluted tubule, while the useful substances will remain on the upper portion and will again move into the blood. So the waste products may enter into the proximal convoluted tubule, then the loop of Henle, and then the distal, and then move towards the collecting ducts and so on. But if a drug is unable to pass through the glomerulus, then sometimes tubular absorption and tubular secretion takes place. So what is tubular absorption and what is tubular secretion? As previously I have told you that proximal tubular secretion is involved in removing of the drugs from the blood back into the proximal tubule. Sometimes, when the drug is unable to cross the glomerulus, then the drug moves from the blood back into this proximal convoluted tubule so that it can cross the whole tubular part and then gets eliminated in the urine. So, this process is known as proximal tubular secretion. And sometimes there takes place tubular reabsorption. Sometimes the drug may uh, reabsorb back into the blood from the lumen of the distal convoluted tubule and enters into the blood, and its uh, excretion may not occur. Then it will again pass through the glomerulus and then will get excreted. So there are three phases of this drug excretion. Another thing which I want to include in this topic is the urine alkalization and acidification of the urine. This line will show us that altering the pH of the urine may increase the ionization of the drug, thereby the drug will be removed easily. If we want to eliminate a drug, and if this drug is in basic form, so we will acidify the urine so that the basic drug may gets easily eliminated. And if the drug is acidic in nature, then we will basify or alkalinization of the urine may take place so that the acidic drug may get easily removed. So here this diagram also shows that filtration and secretion of organic acid back from the blood into the proximal tubule, and lipid soluble drugs are again reabsorbed back into the blood. So this is also useful diagram. So this is a simple topic. First we have studied generalized things about drug excretion. That's simply the removal of drug is called drug excretion. Then some drugs eliminated: saliva, bile, lungs, and main organs are kidneys. Then we have talked about the phases of drug excretion. Here we have studied about the whole processes and anatomical structure, that the glomerular filtration occur and then the tubular reabsorption and then the tubular uh, secretion here takes place, and here the tubular reabsorption takes place. And then we have discussed about how a urine altering pH may affect the drug excretion. Thank you all dear students. If you have any questions or queries, kindly give comments, and thanks for watching ITEL Pharma. Best of luck. Allah Hafiz.